I am Frank Perlmutter. I'm the president of Strategic BCP. I'm proud to present the Compliance Roundtable today. I'm going to be facilitating, doing some commentary too. I just want to I'll give you a little bit of a background on myself and also each of the different panelists. I'm the former DR manager, also known as the COOP manager for the U.S. Department of the Treasury. So I used to be on the, everybody's like, oh, you came over from the dark side now, I guess, depending on who you talk to. So I did risk management, and I also did safety and soundness reviews over a lot of our financial institutions, some of which still exist today, some of which do not. I'll go right here from how you're looking from left to right. This is Wayne Stadnick. Wayne Stadnick has 20 years of business continuity experience. Wayne is now at Accenture, where he is the Global Business Continuity Risk Manager. Wayne was also at a number of other organizations, MoneyGram, TCF Bank. So Wayne's background is heavily within banking and also within technology too. So we're going to try to really be broad on our topics with compliance, but also too, we want to be able to focus on some of the different industries too, on banking, on healthcare, on public utilities too. So some of the more highly regulated industries, and also for the ones that aren't regulated, what frameworks are being used right now to help drive their business continuity programs. Next to Wayne is Chris Duffy. Chris is the triple X. I'll go with the yeah. WWW. There we go. So Chris is the Chief Innovation Officer and also VP of Professional Services at our company, Strategic BCP. Chris is a former CIO at a number of different organizations, education background, also within financial services and healthcare too. So you can see some of the different places that he's done work, government-wise and also in the private sector. And then next to Chris is Eric Jacobson. Eric Jacobson, you can see, is with the manager at the University of Kansas Hospital, which just recently changed. Give me the full name now, Eric.
University of Kansas Health System.
Health System. That's always things get switched up on me now. We have the different acronyms. So anyway, Eric has extensive experience within healthcare. For those of you who are looking to find out about the new CMS reg, or not so new, I guess, that all the different hospitals and I believe, 18 different covered entities. I always love that word in healthcare. Covered entity. What the heck is a covered entity? So hospitals, any kind of patient care facilities, any kind of clinics, everybody, Eric sitting in his garage putting a Band-Aid on his finger, all those different things. So it's very far-reaching within that. So Eric is going to be able to cover that too. And we also have, for those of you within, I don't know if anybody's in the public utility space, the NERC and the FERC standards, and there's multiple ones on that. And we'll also be able to talk about PCI compliance and also some information technology too, some of the NIST standards that we're all dealing with too. So today's session is meant to be very interactive. So I think we have 9 slides, not very slide-centric. So it's meant to have discussion. So we don't know every standard that's out there. We have pretty good coverage in between the four of us, but if you say, if you want to chime in on something and you want to offer up anything, definitely feel free. Just raise your hand, and we'll have you stand up. And any kind of comments, questions, is meant to be very interactive. So with that, what I'll do is I'll cover just the basic, some of the basic parameters for the session. What are you hoping to get out of today? So I'm going to ask you that in a second. Some of the trends that we're seeing right now, some of the uncertainty, I think, with the new administration and where that's going to go. Is that going to be more, less, or somewhere in between, or we just don't know? And then also 2 sections on building a relationship with the auditor, preparing for your auditor. So they have gone through, I don't even know aggregately how many audits together we have gone through. So if we combine it together, I'm sure we're up to several hundred, unfortunately. I apologize for my time in doing that too, and being on the other side. I definitely feel the pain on being audited. So they're going to tell you some of their different strategies. So it's meant to be, how do they, time and time again, when folks are coming into their offices and they're saying, show me this. Oh, no, wait. Show me this. Now I want to see NIST. Now I want to see ISO 22301. Oh, by the way, did you know there's a companion standard, 313? Oh, by the way, the IT guy just came on in. He wants to see PCI. Oh, as per what? Well, I don't know yet. So how do you plan for that? They've been through extensive amount of audits and we'll give the nice term too, examinations. I don't know if that makes it any better, but we'll call it that too. And then open Q&A too. So I wanted to see if anybody wants to offer up. What are you hoping to get out of today? Anything that I haven't mentioned that that anybody would like to cover? Anything? Yes. Oh, okay. SOC 2. Mm-hmm. Okay. That's an interesting one. So SOC 2, covering, doing that attestation of controls across business continuity. That's an interesting one. Because that is at the discretion of the auditor and the examination company. Yeah, it's an interesting one. Yes. Appendix J of the FFIEC.
There's the winner.
Yeah.
I was wondering who was going to say it.
Appendix J of the FFIEC BCP work program. That's a good one, yeah. Vendors, I keep on calling them vendors. Third parties? Yeah. So what is the continuity of your different third-party providers? And then their providers. And then maybe their providers too, going on out. So that's a big one. That is a trend, and financial services really pushes that through into a lot of the other industries. They are a harbinger of things to come, both good and Appendix J. So, anything else? Yes, Ron.
The philosophy of risk analysis to determine whether or not it will save the company money to violate compliance and regulatory trends.
Yeah.
Because it's cheaper to pay the fines.
Cheaper to pay the fines. That's interesting. I'll ask a couple of examples of that. We've seen that where they're like, do I really care? Am I willing to take on those fines? That was a big conversation around HIPAA, not necessarily around business continuity, but around some of those regulations. And they said, you know what? Look, this is going to cost us an arm and a leg to implement. We need to put in a system to protect our health records and things like that. So, Eric, I know that was a big one. Well, we may be able to. I can disclose stuff. I think Chris might be able to. Wayne and Eric will say. I know that there's probably some sensitivity around that too. But that's an excellent point. How do you fight that? How do you really get them to do what they're supposed to do? Yes. When and how to say no to auditors and regulators. Yeah, when they come up to you and they say, I want this massive binder where you put them in their place. That's interesting because I know that several of our panelists have had to have interesting discussions before. So how do you do that? Yes? Oh, excellent. Fantastic. No, that's okay. That's okay. Come on. Strengthen numbers. Peter and I strengthen numbers, right? Oh, excellent, excellent. So you're okay from the Fed. Excellent. Yeah. Excellent. So Fed and OCC, so that's great. So when we talk about the FFIEC BCP work program in Appendix J, what is that looking like? How I remember when I was an examiner and you would get these booklets, it was looking into those and it said, it is at the discretion of the examiner how the following is at the discretion of the examiner how the following is administered. Interesting. So creating that consistency and preparation and everything. So, yeah, hey, it's a tough job. You know what? And the thing is like, it's a tough job to be an auditor and an examiner. And I think as we go on in, they want you to be successful. They don't want you, you don't want to write up folks. It's, the strength of our financial system depends on doing things the right way. That's why these things are written up. And when going in and doing those examinations, you want to partner on there. When it gets to the point of where it becomes a little adversarial on there, that's when you haven't done what you're supposed to do. So, all right, excellent. Are you ready?
Fire away.
Fire away, okay. Great. Okay. So we're going to start off with some of the different regulations, standards, and best practices out there, and just have like pretty much an open session on this. And each of our experts over here, I'm going to call on to talk a little bit about what we're looking at up here. You'll notice definitely what's on the top of your mind is what's on the top of a lot of people's minds. You see, I think we hit on everything. There's our SOC 2. There's our FFIEC. There's our spotlight on there. So healthcare. Eric, tell us, and Chris too, tell us a little bit about can I do the whole thing? Let's see, Centers for Medicare and Medicaid Management Emergency Preparedness Standard, right? Did I get it right?
Oh, I think you did.
I think I got it right. All right. That's it.
Well,
now I'm out of breath.
The CMS standards, they're very generic, and most of your larger hospitals or your larger facilities will have a lot of those covered, especially if they're following the Joint Commission. The smaller and more rural places, they'll be more hard-pressed to actually be able to implement these new standards. The smaller doctor's offices, they're a little bit differently. Like the clinics, they have to follow the patients while they're in the facility, but once they're outside of the facility, they no longer have to follow them, know where they're going, unless they're sending them to another facility. That's the broad concept of the CMS standards. Each kind of healthcare facility has a little bit different standards, but a lot of them just really what's the best for the patient. And you're following the county and the state and the federal regulations. If they're doing that, you're pretty much following the CMS standards.
Yeah, and Eric, when the new rule that just came out that relates to pretty much emergency preparedness really laid out some nice definitions on who's covered and who's not, as far as mostly inpatient care.
Correct.
Yeah.
It is. You have to do everything possible for any kind of hazard to maintain the facility for your patients that are currently in-house. Now, again, when it's the clinics, once they leave, it's no longer your responsibility.
And we are hearing that the smaller healthcare institutions are truly hard-pressed. They're looking for that help financially to help offset that, because that just sits as another burden on top of what they already have. The nice thing about the standard is how it is actually, the rule, it's how well written it is and what it does and what it doesn't cover. And taking that all hazards approach as well, which
Correct.
is very refreshing.
It is. They break it down to each individual type of healthcare facility, anywhere from just a regular doctor's office to inpatient to long-term health care, for your older senior citizens. And they break it down very nicely in each of the regs or regulations for those type of facilities.
If someone was a participant in a consumer-directed program, would their house be considered as a facility?
Are you taking care? Are they taking care of somebody?
Do you want me to carry that around?
Hospice.
Somebody's nephew is taking care of a patient. So, for example, if somebody's nephew was taking care of a patient inside the patient's home, they're in a consumer-directed program, so they're in a Medicaid or Medicare program, would that patient's house be considered a medical facility? The reason I'm asking is that the company I work for is a mandatory reporter, so if anything were to happen, I want to know whether or not I need to report something.
That would be considered a home health facility, and yes, there are regulations that are directed especially for those. Not quite as stringent as an inpatient health care, but yeah, they do have regulations for home health.
All right, great. How many healthcare organizations? Show of hands. Okay, great. Any types of challenges you want to ask? Anything that you have questions about on CMS? Oh. That's okay. Yep. We'll bring it back just in case.
I just wanted to add as well, we have been here. I'm from a suburb of Chicago, so we're North Shore Health System. So we include 4 hospitals, home health, et cetera, a large medical group. One of the big things that we've noticed with CMS that we're actually waiting for more specific guidance on is the communications plan, which is a lot more comprehensive than what Joint Commission has been asking for. So that's the part that I think even larger health systems are challenged with this year, to prepare and make sure that every single piece, every single task and standard is addressed to make sure CMS doesn't come out to audit us.
Yeah. Thank you. Yeah, it's been tricky. I mean, there was, I think, the big,
Yeah, they have till November.
one of the most alarming things that people were seeing about CMS standard was the 48-hour rule. Everything's got to be all set. You got to be serving patients in 48 hours no matter what. That got struck because there was a tremendous amount of, If you actually saw, it's interesting when they're coming out with a rule, they post it up and you get to see the comments, and almost every comment was, at 48 hours, no way. Too much of a burden. We can't do it. That's scary when you think about that too. It's scary for if you're in those organizations, and it's also scary too if you're not ready to comply with that, what that's going to do to the organization, the burden.
Well, I think one of the other challenges that the healthcare has is you've got a year. November, right? Yeah. You have a year to comply.
Yeah, that seems like a lot of time. Not for
Maybe
it used to seem like a lot of time. Yeah.
To be examined.
Okay, so let's move on to the next area on there, FFIEC. So it's long a part of my world, and a lot of banking, financial services. It's expanding out. Banks, FIs. Anybody affected? Okay, a lot of people. Yeah, the FFIEC. Essentially, I'll give a bit of an overview, and then this is definitely Wayne and a bit of Chris too on this. So this has been around since what was the first? Was it 2003 when I think the first? And it had a lot longer name too. It was like the Business Continuity Examination Handbook. Used to be seen. A lot of folks saw this as the gold standard of business continuity planning. If you really wanted to do a good, a BIA. And you really wanted to map operations, and you really wanted to do interdependencies. People were using this as a framework because you can easily download it right off the internet. You would take it off, and you could see all the different points that you could use in your framework to do it. So, we used to see it across a lot of different organizations. It was, like I said, this was a great predictor of things to come. Then what happened was, and there's a lot of handbooks on a lot of different topics too. And typically the examiner is going to use that as a guide on how they're going to come in and to and to look at your financial institution. So we all know that. There's actually a place in the back where you used to be able to fill it out too. I think it's been a little while since that's still there. Is that still there? Yeah, the little procedures, and then you could say how well somebody is matched up against those. Okay, all right. So it's good. It's like a workbook. It's really it's highly applicable. It's highly actionable. So recently, Appendix J came out on third parties, and it created something new, very new out there. And from what we saw, enforcement was fairly quick on some of the larger financial institutions to ensure compliance with this. It's very, very important. So, Wayne, why don't you start? Tell us a little bit about Appendix J, and we may go around too and see. This is a big one.
Thanks, Frank. Well, just so I can make the attorneys happy, I've got 20-odd years, like Frank said, in the financial industry services. The comments I will reflect today are my own. They are not representative of Accenture. So now that I have that part out of the way, we can go forward with that. For all of you in the financial institutions, who has not downloaded the workbook from the OCC website? Fantastic. That thing gives you a guide in there. Your examiners, be they from the OCC or another third party, are going to follow that like a Bible. Then came Appendix J, and it threw the financial industries into a tizzy because nobody really knew how to interpret it, because not only does Appendix J cover the ubiquitous third party, fourth party, and in some cases, depending on your examiner, they will ask questions around fifth parties, but it also threw in cybersecurity. For some reason, cybersecurity is now part of Appendix J, which threw the information security world into a twist as well, because suddenly not only you have the FFIEC workbook, you now have third-party rules, you have fourth-party rules, and to couple it all together, you now have cybersecurity responsibilities all under the realm of business continuity. We'll talk a little bit more in the future about partnering with your examiners, and I think that's absolutely key. I can't tell you guys enough. I have been lucky enough in my years of experience to never come away with less than a satisfactory on an exam, and it is because of the partnership I did with my examiners before, during, and after to understand exactly what it is they're looking for. Most of those guys out there, yes, they are examiners. They are the Fed. They're looking at your stuff and they're looking hard. But if you work with them, they're pretty decent folks for the most part at the end of the day, and they'll work with you. That being said, it's your responsibility. If you don't do these kind of things, they're going to figure it out. Auditors or examiners today are not the checklist that some of us with a little more silver or less hair than we used to have were used to. They have come from the industry. They're smarter, they're trained, and they know what they're looking for. So it behooves you overall to form that relationship with them and actually ask them what they're looking for. Somebody threw out a comment earlier about how to say no or when to not give up information during an exam. I have never done that. I can tell you that. Flat out, I have worked to understand exactly what the examiner was looking for and drilled down to a fine level of detail. But the ramifications of not complying with an examiner's request were far too stringent for me to ever take that risk. If I had dirty laundry, I did share it, but I also sent a message along with my dirty laundry to say, I know we may be weak here, but we're working on it. Here's the work plan associated with it. And like I said, if you tie that back, most examiners will work with you on that kind of a thing. They're not out there to make your life completely difficult.
Yeah. Okay. I know this is a hot topic out there. Yes? Give me the microphone. There you go.
Are they fairly concrete about what they want in terms of cybersecurity?
No.
Not just antivirus, whatever.
No. And that is why I mentioned, and it's the same thing with your vendor examination. Appendix J threw everybody into a tizzy because, no offense, it was not well written. Okay, great. And there is an effort underway to rewrite Appendix J because so many people, even the examiners, were confused as to what to do. So when my examiners came in, I literally scheduled a special meeting just on Appendix J to understand what everybody wanted to know. And it worked well for me.
Well, I think you said it perfectly. Is I met with them to get clarity. We're working with one of our large financial institutions right now for third-party testing. I flew down and we met with the examiners and said, what exactly are you looking from a deliverables and an outcome from this third-party testing so that we can get you what you want? So it really, it took it because the chief risk officer was just like, what do we do? And it wasn't that he was looking for help. He said, I don't have any clarity here.
Yeah, it's difficult, and that's where you really have to, it's more of, there's sort of the second, the primary and secondary research where you have things that are written down that you can refer to, but there's a lot of this primary asking that where you have to make that one-on-one relationship with your examiner. Can you hear those guys okay? Anybody not able to hear in the back? Yeah, a little. Sure. Yeah. I think they're, I wasn't sure if they were close enough. Okay.
We'll work it.
Yeah, there you go. Okay. You got two. All right.
Stereo.
Okay. Yes.
Won't the SSAE 18 help in determining third party because it forces disclosure more so than the SSAE 16?
That's an excellent point, and I agree. Oh, thank you. And I do agree with that one. There are a lot of things that are going to provide more clarity, but as they sit today, unfortunately, there's still quite a bit of fog on the mirror. So that's why that partnership needs to be built in order so that you can come out of it with a greater chance of success.
Hi, I work at a bank, and when Appendix J came out, we thoroughly analyzed it, put together a spreadsheet, and identified 41 specific items that we're looking for. Then we assigned a committee. There were 6 of us that we went through it one by one, and wanted to see, do we have this covered? If not, what do we need to do? And by the end of the year, we had the end of 2015, because that's when it came out, we had most of the items addressed, and we were examined in March of 2016 by the OCC, specifically on Appendix J, and passed. Had no issues at all, no MRAs.
Congratulations. That's an excellent strategy, and that's why I mentioned earlier.
All right.
That stuff is downloadable out there, folks. It will give you the playbook that they're going to use. So congratulations.
We did use that questionnaire.
Mm-hmm.
Okay.
Frank,
All right. Excellent. Oh, was there
over here.
Oh, okay. Oh, I'm looking in the wrong place. Here we go.
Just a couple of points on perspective. Many of the examiners saw Appendix J for the first time at the same time that you did. It's a false assumption that the examiners get advanced look and advanced training. So that's one thing. And two, yesterday I got an email saying, please comment on the revised BCP handbook. So there are changes coming.
Good.
I have to get that in by Friday.
What are you doing here?
Looking for hints.
Exactly.
He's got 2.5 days. Yeah, exactly.
All right. Terry's got the mic now. He said I looked winded.
I'm mic guy.
Okay. You know what? I'm going to, unless nobody mentioned ISO 31000, actually really great standard on overall risk management. They're rewriting that right now. So comment period is open. I would encourage you to take a look at that. That really is directing a lot of the how business continuity is going. Definitely take a look. We have some actually really good materials out on our website. I'll provide that to you later on ISO 31000 and also on COSO on the ERM cube that a lot of people are utilizing in that risk management space. Okay, service organization. So our SOC2, the SOC, one of our favorites, the attestation of controls. I know my company does it. I know my hosting company does that. Show of hands. SOC 2, formerly known as the, anybody know? SAS 70. Yeah, that's right, the SAS 70. So this is interesting. When I don't know if any of you guys want to discuss a bit about that. Chris? No, Chris. Wayne?
No, I've been through it with you.
Anything? Okay. I'd be happy to discuss it, yeah.
Well,
on that,
the SOC 2, as we all know, we just heard somebody out there who has some tenure under them too, remembers the days of the SAS 70. Service bureaus have to do this, flat out. You're going to get it with along coupled usually with an SSAE 16. Sometimes those guys just marry and march together on those type of examinations. Business continuity and disaster recovery, no surprise, is a key point within those examinations, and auditors will draw down. We're going to talk here in a slide or two about how you gather data, the type of the data, and what I have been finding more and more as a pattern, whether it be from either the OCC or other external examiners, that or PCI, is that it used to be when people came in with the checklist examination, they wanted to know if you did a test. It was never defined in any of the regulations what a test constitutes. So it could have been very, very light. Examiners are going much deeper nowadays to understand exactly what you're testing. So if you're only doing tabletops, I'd encourage you to introduce a level of rigidity around that and go deeper. Because every one of the examiners is beginning to understand at a much deeper level what business continuity, disaster recovery is all about, and they're looking.
Yeah, the SOC2 was always, it was interesting back in the SAS 70 days. I was with the Big Four, and we would choose with the client what the controls we did. It's like, I want to look at backups and recovery. I want to look at I want to look at salvage procedures. I want to look at testing. What do you want to look at? And you would test the controls if you were doing a type 2. You would go in and you would say, all right, prove it to me. Show me that's what it was. It hasn't changed much today, I think, in the methodology, but in how the controls are selected have changed, because it's essentially, you say, oh, I want to see, strategic BCP and how you do resilience one. I'm going to hand you something, and it's going to say everything about my security in there. It's going to say everything about my operations. It's going to have a test in there, and you go, yo, you missed something in here. You missed the part that I care the most about. Oh, are you segregating my data from the other client's data? Are you doing that? So there's a little bit of twist and turns in there, and it's a presentation. I think one of the biggest things, and I don't know, it used to be missed, I'm not sure anymore, was that it was a marketing tool for companies to say, look, somebody has looked at this. And they are saying, because they are certified and, to say so, that you comply or conform to these standards. You can't comply with that because it's an attestation. So we'll go over some of the different words too. Yeah. See, I even get caught up still, I align, I conform, I comply. Align, conform, comply. Align is you can align with the best practice. Yeah, we're doing things like it's showing us to do in there. You can conform to a standard. Okay? You can conform to that. You can't comply with it because there's nobody that's going to be auditing you, no regulatory body, and then you can comply with with the regulation on there. So we'll go over that too, because that's an important distinction, and it'll help you with the myriad of different things that you can align, conform, and comply with. PCI and NIST standards, I know that wasn't brought up. I want to cover the things that matter the most to people. Anybody want to cover that? Show of hands? Yeah? Okay. All right. So a couple of hands in the audience. Okay. So the PCI and the NIST standards. Talk a little bit about that. I know all three of you definitely have some perspective on that.
Well, it's PCI. For those of you, I saw two hands go up under PCI. One of the newest things that's come out with that little special standard is, as you laugh, PCI has now gone out to an extent. For those of you who are not aware, PCI is a standard developed by Visa and MasterCard. It says if you want to deal with us, you will do this laundry list of things. Well, yep, I forgot the third one. Yep.
I was waiting for that. I'm like,
and PCI has now gone to the point where they have leveraged fines. Now, there is some conversations going on because a standard issued by the card vendor that is also going to fine you. There are some questions about how the money's moving around and whether that is truly legal at this point or not. Yeah, but you got to give them credit. They're trying to find another way to get a buck. Yeah. PCI is a challenge for those. Fortunately, there's only two people in the room. Do you use a third party for your PCI certifications? TrustWave or somebody like that? Okay. They're almost ubiquitous in that realm. So.
Yep.
Well, the question, of course, is: do you hold credit card information on your mainframe? And if the answer is yes, PCI DSS will now also address that, how your terminal emulators can work, and what needs to be masked, blah, blah, blah. So it now attacks your mainframe.
Yep. They have become ubiquitous in that world. It used to be fairly defined, and it has just gotten broad, which is why companies like TrustWave are doing a wealth of business today. And again, it's another thing for an examiner. Partner with that examiner. PCI, the fine aside, I think the largest one I've seen so far has been $50,000. Honestly, it's piddly. The problem with it is if you get flagged as non-compliant PCI, the reputational damage and the other downstream effects of being labeled as non-PCI compliant far outweigh any little monetary fine that you're going to get. Yes, sir.
Well, I was just going to say, in regards to PCI compliance, one of the issues that we have, and I work in we're an IT services call center facility. We don't take credit cards as a matter of business, but we troubleshoot retail and computer-related issues. So potentially, I have an agent that accidentally puts a credit card number inside a database that now resides somewhere.
Yep.
And that's where we struggle, or we struggle with customers too that say, well, you have to be PCI compliant. Well, I don't process credit card data. I'm not intending to take credit card data. I'm not going to be PCI compliant. I'm not going to spend the money. And what am I being compliant to? You know, the first step of PCI compliance is, well, where is the credit card data stored? Nowhere. So I don't want it.
It's always a battle. I mean, I worked for a bank that said, we issue Visa cards. We are not compliant. That is done by the vendor. That is an interesting conversation when the various regulatory bodies get together. It's not a happy conversation because you end up stuck in the middle with people doing the point of the person in the middle.
Yeah.
Well, that's your problem. No, it's
Yeah,
that
they're passing
problem.
the buck. Well,
And at
there's,
the end of the day,
yeah.
it's your problem,
Yeah.
guys.
There's
Whether you intend to or not, whether your data is at rest or whether your data is in transit, they're going to look. Mm-hmm. Mm-mm. It
Yeah.
is a thou shalt.
I was going to say, as a vendor, the clients pass their PCI on to us, and then we have to determine who is responsible, in servicing their account. We've gone to the fact that anybody who touches or talks to that account or talks of that account now has to be trained in PCI and provide evidence of such. So it has far extending arms as it comes over into the vendor world.
You know, the nice thing is that all of our discussion around PCI really makes the OCC look good at this point in time, doesn't it?
Oh,
that's good.
Yeah.
Yep. Okay. I know we're. I know we've spent quite a bit of time on this. I want to see with any public utilities in here.
We have clients.
Oh, okay. So we'll briefly mention that. I know Chris is. I think we're now. I think we're working with about 45% of the. What's that? I'm sorry. This month. Yep. Do you want to?
It's more so with the NERC requirement, nuclear energy regulatory, is I would say where the FFIEC was the gold standard. It is far more rigorous, especially on the IT side. The detail on the testing, attestation on plan generation, revision controls, it's outstanding.
Yeah, they put a lot in there, and the privacy of the data too, of like utilizing the plans of where you're almost like it's interesting with financial services, right? We would go in and some of the plans were like it wasn't the plan to recover fixed income securities, it was plan 001-AB-2, and you would go, what the heck is that? And you'd have to get out the code to see what that is. So it's even like it's hard to use a plan when you're highly securing that plan. It's like, do you have your key? You have your key? Yeah, let's do it.
Yeah. But that's cultural too. When you're in that organization, they live and breathe it without even thinking an eye. They know it.
I was going to add, I used to work for an electric utility and did a bunch of consulting at an electric utility, and it's amazing that the NERC side of the house, it's like a big line of demarcation on the plans and how they react, which is probably expected. It's a shame they don't talk to each other because the FERC side of the house has a long way to go, as we found out in the blackout that kept tripping back in the early 2000s. So, NERC, pretty good. FERC,
it's variance. It's like in healthcare. I think you have that too, right? What we were talking, it was HIPAA, not so great.
Correct.
Yeah.
The HIPAA regulations are very vague, and basically whatever the industry standard is. When we work on the IT side versus other regulations that are a little more prescriptive, a little more identified.
So, moving from some of the specific standards, I think when you're looking at what do you do? What's my focus on this? And I'm sure many of you, if you've attended one of our presentations, you've seen this before. There's always that hot standard that's out there. So right now, what are we still talking about? A couple of years now, ISO, 22301, And it's interesting because that is, if you read it and you compare it, it's very, I used to say it was like a certain type, it was like a sandwich that had a lot of bread and not a lot of meat in the middle on there. It's like, well, let me tell you how you can maintain your plans. Let me tell you the governance. Let me tell you the scoping. Let me tell you this. I'm like, what about all the procedures that no. Let me tell you about this. Let me tell you how you monitor it, audit it. The verbs were wrong. They were all of these very passive types of things. And it's interesting because we were talking about it. You see, like, you have regulations. You have to do this. You have to do a regulation. Okay, you have to do what they say in there. When you look at the standards and the best practices, those are voluntary. Is it good to have your ISO 22301 certification? Maybe. Some people say yes. Some people, and it's interesting because you'll see it's the Good Housekeeping seal of approval right now. But a couple of years ago it was BS 25999, and then, PS Prep, BS 25999. There was a gentleman in here I toured with on NFPA 1600 way back when, and it's like, so next is going to be what? What is that going to be? And they're all very, very similar on there. So the framework, building that framework on those standards and best practices, fantastic, okay? But what are the regulators using? You have only so much time in a day, and you have to do these certain things. Wouldn't it be great if you could do that? That's great, and that may satisfy things, but it's also, hey, Terry, come on up. We have a question too. It's also, when you look at this, what's really most important to do? So we just saw, there's a couple of examples. Yeah.
But if you do set the clock back, Frank, and you hit it right on the head, organizations spent a lot of money years ago on BS 25999.
They did, yeah.
And had a lot of audit work done, a lot of field work, and it costs a boatload of money to get that, quote, certification. And in some organizations, they certified subsets of their organization. 2 men and a blind dog in that department are certified, and now XYZ Corporation acts like it's certified. But the reality of it is, it costs a lot of money. So how do you know? How do you know when to jump in? How do you know when to step back and say, 22301? You spend your money first, and I'll figure out later on if I want to follow you. Because right now, it's the 25. Well, it's probably more mature than 25999 was at early years.
Yeah.
But I don't know that it's real yet.
That's right. Yeah, when you look at that, a lot of people ask that. They say, what is the real relevance of 22301? I mean, it was just the British Standards Institute did a study. They said, how important is it to your organization? Very important. How many people? Somewhat important. Not important at all. So up at the top, 5% of organizations said, yeah, this is really important. And it's typically, like a lot of these things, it was a shame because, you're looking, Chris is smiling because of professional services. That's it. There's a lot of money for consulting companies to go on in and to certify against a voluntary or a mandatory standard. I want to be prepared. I want to be able to do this. But the thing is like, if they're spending money on you to do something, don't you want to spend it on something that you have to do, where you can really deliver that value? So I think if you can deliver value to your customers or to, internal or external, that's when you might want to jump in and you say, hey, this is going to be a lot. What is it going to get us? Like, people are expecting, this is going to get us business to do, here or there or the other thing. I haven't heard of that, really. It was almost like the old thing of like, oh, now I have this and they're going to lower my insurance premiums. You remember that old, that's like that's the oldest thing in there. And I'm like, good. Go to any insurance companies and they would all make a beeline for their, oh yeah, that sounds good. So, when you look at those kind of things, what the focus is. I did have also internal and external too. Any questions on that? Concerns in that? Okay.
Hey Frank?
Yeah.
I have a question.
You do have a question?
I do, for the audience. Go for it. And then I have a follow-up for Peter as it relates to it. So internal to us, ISO 22317, the BIA standard. Anybody here familiar with it? It's awesome. It actually has some process and workflow and clarity built into it. You do a BIA on a business process. You look at inflows and outflows and how it relates to downstream dependencies. So it really provides that clarity on what is a BIA. So it's not open to interpretation. I'm not going to do one in an IT service. I'm going to do it here in the finance department at this function level. I'm going to identify the resources. So it builds on 301.
Yep.
But I look at it as it having that clarity that it needs to do that, especially from a deliverable. is I'm able to deliver an ISO 22317 BIA, and here's where we map to the standard exactly.
It's important. There's, it's funny. ISO does this a lot, where it's ISO 22301, and please refer to this one and this one and this one and this one. So, the first thing that we did, we saw 301, and I'm like, and you saw it. I said, you want to read it? And it's like, I don't get it. It's like, where is it? I'm like, oh, here's 313. That's where a lot of the meat is, in 313. Why aren't we auditing against 313? Well, 301. That's the one that they're going with. And then there's 317. And then there's 318, BIA, supply chain. There's all of these referential standards that come out. You have the base standard in there of the 000 or 001s, and then you're starting to add on all these additional ones. The thing is that we typically never find, we always talk about this. I'm like, okay, here's what you should do. Great, you should have a BIA. Okay, now how do I do it? Oh, that's up to you. And that's interesting. And is it really up to you?
Yeah. Well, the nice thing about the standard, and I use it, I will quote the line that the sentence sits on, where it says, line 293, have interdependencies between processes. So again, I'm excited by that fact that there's some clarity. So Peter, right? I'm going to call you out on this one. So we have regulatory or mandatory and optional. I'm going to choose to follow the checklist on the FFIEC and kind of skip over ISO. Am I in trouble?
Depends how well you do on following the checklist.
It's a wait for Pete.
That's good.
So the FFIEC agencies, I'm going to exaggerate, they deny the existence of anything else but the FFIEC guidelines. Now, they may plagiarize, but once they've plagiarized, all there is the FFIEC. So if you come and say, look, I'm ISO certified, whatever the number, in whatever the domain, we say, yawn, nice, but here's our handbook.
Yeah. It's interesting. Then there's a lot of, when you look at the standards too, there's a lot of that redundancy. We map something called the genome, where we synthesize the standards together. We did 32 of them. Okay, it's wonderful, isn't it? All doing all that work. Anyway, after about 4, it was like, oh, they're saying the same thing. Oh, and they're saying the same thing, and the same thing, and the same thing, and the same thing. They're all saying, hey, you have to have this type of a policy in here. And maybe there's a little bit of a twist. They may call something a little different. I don't call it assumptions anymore. I call it, put that in your scoping area. Oh, we don't like that. But it's minutia. And if you establish something based upon the framework like that, like the FFIEC handbook, and like maybe one of the NERC standards, and NFPA is we haven't talked about that, is fantastic for crisis management, and also for giving a list of risks. They always have a good risk register in there. There's about 70 of them. So if you're ever wondering, all the different bad things that can happen, that's a good place to look at. I know we only have about 10 minutes left, so I wanted to go a little bit more rapidly through some of the other things here. So key questions to ask before your audit. So now that we know what we need to comply with and conform to, maybe align. I don't know. There's not a lot of aligners right now. We don't have time for aligning, right? Anyway, so if you look here, you need to know the constraints. You can see, know the scope, who's examining you, get the workbook before. I want to go down the line a little bit and just get some brief comments, just going from Eric to Wayne. Eric, what are some of the things that you do to prepare for your audits?
Well, we kind of look back at our history, what they've audited in the past, and see if there's anything new and updated that we need to follow up on. And then, of course, we try to ask the auditor, what are you going to be looking for this time? And where does it follow? What regulation do we need to follow to make sure we have the right documents or the right compliance for it? So it's kind of a little bit of both history and then, of course, working with your auditor to identify what they actually are wanting at this point in time.
Chris?
Yeah, so I'm a little different. I'm going in with the client to the auditors, which is actually really exciting. And again, we're going to look at previous internal audits, external audits, any of those deficiencies, and we'll actually meet with the auditors ahead of time in getting that preparation work done. And that has been the first one. I must have lost about 20 pounds in sweating it, and then after that, I was like, oh, it's really not bad at all. It's really getting that preparation work ahead of that, so when they come, everything is laid out very clearly. Those expectations are met.
Wayne?
And just parroting on or piling on what Chris just said, a lot of the examiners nowadays are using your internal audit findings, and then they're auditing the auditors as well as your program on that. So it behooves you guys to get on the same page, sing from the same book when those guys are in front of you. And like I said before, if you tell a decent story, my experience over the decades has been that the examiners will work with you. There's an old line out there that says, not to reveal does not mean conceal. Use that very carefully in your operations, because these are people that can help you or can make your lives incredibly difficult. So it is on you to form that relationship. They're not fun conversations to sit down there. They're rather tenuous in the beginning. They can be actually a little tense. But it's on both of your sides, and if you don't form that relationship with your examiner, sitting there is like going up to the old Inquisition kind of a chair with the light bulb hanging above you, and that's the last place you want to be when you're trying to represent your company.
Yeah. We have a client who was in an MRIA, and
can you define what that is?
No, I don't know what it means. Matters requiring immediate attention. And they were going through an acquisition period, so it was compounding on it. And what we did is laid out a plan. So when the auditor came, we actually did a timeline, swim lanes. This is where we are deficient. This is what the organization and strategic BCP are going to do, and this is when we're looking to be able to have it addressed. And it wasn't over a year. It was pretty aggressive, not from our perspective, from an internal control standpoint. So we looked to have it done in 18 to 24 months. And we laid it out for them. We were done in 12. But again, that really went a long way into getting a satisfactory.
What? Can I ask you a question? When for the audience's edification on that, when you see a body that you're examining come to you with a plan, with open communication like that, how do you guys typically respond versus having to draw every bit of information out of a particular organization?
Yes, that's a really great question. Some of us take the same initiative that you do and build a relationship and build a rapport. So there's frequently side conversations, if you will. But others take a very hardline, draconian, the Inquisition kind of approach. So I'll answer for me, and for me, the conversational aspect always works better. Mm-hmm. The rapport, the relationship.
However, excuse me for interrupting, folks, he is an examiner. There is no unofficial conversation that happens with an examiner, whether it's a sidebar, a hallway meeting, or anything. Sorry, Peter, please go ahead.
Let's say casual instead of unofficial.
Yep.
But what I've always gone with is I'm much more comfortable with an institution making a well thought out, well documented, stupid decision than a stupid decision just made out of oops. So if I can look at the thought pattern, I'm much more apt to sign off on it than just seeing black and white.
Yep.
Does that answer it?
No, it's an excellent answer, and it's that self-identification thing.
Well, one thing you don't want to do, and the company will remain nameless, but we had an OCC auditor in. We had a BIA. It was the first one done in a couple of years. We had a plan. We knew where we were going. And then they right-sized the organization with no more business continuity pieces. And so the OCC was going in. Well, I contacted my OCC contact and said, when you go in, no one you know is going to be there anymore, but here are some questions you may want to ask. And this company actually fed this auditor false information, test plans that were never taken, and said they passed the test that they in fact failed. It became a finding of fact, wound up in the 10Q, the 10K, and the annual report. And I'm pleased to report the CIO lost his six-figure bonus, but not his job. So don't lie to these people.
There's actually a law that says you can't lie to us. Yeah, and my wife thinks she's opted out from that law.
Awesome. Thank you.
Okay. Yeah, I think that, when you look at overall on some of this, just in wrapping up, I think you'll see that, it's interesting. I think defining scope is another thing that we talked a lot about too. It's what part of the organization are they auditing? Are they coming in and just looking at one specific part, or is it the entire? If we go into healthcare as a particular challenge on this, is like, is it Maine? Is it the entire health system? Is it just these entities or these types of entities on here? It can get very tricky because you're like, all right, we're ready, and then they go, I'm going out to Switzerland to go look at those guys. You're like, oh my God, I just did the wrong one. So that's good to know what that is. For auditors today, we had some summary points on here. I think what you'll see is that I can tell you as a senior IT auditor for Ernst & Young and PwC, I was the expert with my checklist, and I'm going, do you do this? Do you do this? Can you give me the papers? Do you do that? That is not the case anymore. In a lot of organizations, that's not, they're smarter now. You can see. We're not talking about checking the box. Do you do backups? Do you, what do you do with your tapes? This is interdependency analysis. This is show me your work too. So you can see the long and short is that a lot more thorough in what's being looked at. Okay. A couple more tips here. I know you can see on there we've already. You can say whatever you do, do not lie on there. So we've gone over a lot of these other points too, and I wanted to finish up. You can see there's the contact information for all of us. We'll stay for until they kick us out for the next session here. If you have any types of questions, we each have cards on here. So I want to thank all of you for attending today and all of your participation. It was great. And I also wanted to tell you, too, there are online LinkedIn groups where we're talking about this fairly actively around different industries, actually around financial services, around healthcare, around utilities, and there's more in each of them. There's I believe, somewhere in between around 600 and 1,000 members on there. So it's a lot of your peers that are wondering about this kind of thing, too. We're going to post that up to each of those. If you have any questions on that, I actually run both of those work groups, so I'm more than happy to add you as a member to those. And thank you, and thanks to all of our panelists for flying down to Florida. I know it must have been tough coming from the very cold locations that you were in. And thanks again. Oh, yes.
Go
ahead.
I just have one thing
sure.
that I need to say, because I shared some fairly candid information, and I don't have a disclaimer like you did. So if you just look at the light.
Flashy thing. Well done, sir. All right.